Good afternoon, everyone. Thank you for joining today's webinar, The Fierce Urgency of Now, Federal and State Policy Recommendations to Address COVID-19 Health Inequities. We appreciate our speakers, Senator Catherine Cortez Masto, Clint Odom from the National Urban League, and Amber Hewitt from Families USA, for joining us today to share their insights and expertise. They will discuss how the COVID-19 crisis reveals legacies of disinvestment and inequities in communities of color, and how you as advocates can take action to organize for justice at the state and federal level. We thank all of you for taking the time to learn and take action in your state. A few housekeeping notes before we get started. Today's presentation is being recorded. The slides and recording will be made available. We will have a brief Q&A for the Senator after her remarks, and there will also be time for questions at the end of the webinar. Casey Badminton from the Senator's office will be on the line at the end of the webinar to answer any remaining questions for her. Please feel free to ask questions at any time via the chat function. We will also open up the phone line for the Q&A portions for those who are participating by phone. So with that, I will turn it over to my colleague Amber Hewitt, Director of Health Equity at Families USA, to share key findings and recommendations from our recent report.
Thank you, Lauren, and good afternoon, and thank you for joining our webinar. I'm Amber Hewitt, the Director of Health Equity at Families USA, and I was the lead author along with my colleagues Elliot Fishman, Winnie Liu, and Lee Taylor Penn on a comprehensive report that addresses the stark racial and ethnic inequities in COVID-19 outcomes, which disproportionately impact Black, Indigenous people of color. We called it the fierce urgency of now. The purpose of the report was to apply an equity lens, specifically a racial equity lens, in our diagnoses of the policy issues stemming from the pandemic and identified policy solutions. We know that disparities in COVID-19 health outcomes stem from health inequities rooted in systemic racism and unjust social and economic policies. Next slide, please. We framed our report and policy recommendations in part on the Prevention Institute's Trajectory of Health Equity model. As you see, their model illustrates that disparities alone does not provide social or historical context in terms of power and fairness. Public conversations surrounding COVID-19 health outcomes have centered on the link between pre-existing conditions and health inequity, represented by the last two circles on the figure, rather than how differential rates of chronic conditions came about, how exposures such as community trauma, neighborhood disinvestment, and environmental toxins can cause or further exacerbate those conditions, and how these in turn are driven by inequities in political power and economic institutions. This illustration also shows that we need to widen our policy lens to capture the full scope of what's needed to drive health equity. Next slide, please. Our report produced a county-level analysis across 11 counties that have been at the center of national COVID-19 disparities and also have high Black and Latino populations. Those counties were Cook County, Los Angeles County, all 5 New York City boroughs, Wisconsin County, Orleans Parish, Milwaukee County, Prince George's, Maryland, and Wayne County located in Michigan. It's important to note that our analysis was conducted in early May, and there's been high variability in testing and overall pandemic response across counties, so our comparison is not definitive. Next slide, please. We used 3 measures for our analysis. You'll see on the x-axis for Figure 2, the Robert Wood Johnson Foundation County Health Rankings, the Gini Index of Economic Inequality, which we described qualitatively in the report, and you'll see on the x-axis in Figure 3, the Area Deprivation Index, or the ADI. The Robert Wood Johnson County Rankings includes 2 composite scores. For Figure 2, we graphed COVID-19 case disparities against those health factors, which takes into consideration health behaviors, clinical care, and the social, economic, and physical environment that influences health outcomes. The Area Deprivation Index on Figure 3 is a measure created by HRSA that accounts for rankings of socioeconomic status. It can also be thought as a measure of how well-resourced a community is or the level of community disinvestment. You'll see from these two figures that in all of these places, COVID-19 cases and deaths are correlated with poor population health outcomes, low measures on drivers of health, and economic inequality and deprivation. And although New York City does not break down at the time of our report county-level COVID-19 cases by race, which is why they aren't represented on those two figures, a zip code analysis and citywide figures make clear that our nation's largest COVID outbreak was heavily concentrated in parts of the city with high Black and Latino populations. If you look at the two charts, you'll also see that both Wayne County, which includes Detroit, and Milwaukee County rank close to last in their respective states for scores on health factors and health outcomes. They also have similarly high area deprivation index. And you also see that those counties have the highest rates of disparity among the counties analyzed. So what do those correlations mean for health equity policy? As a starting point, they mean that mechanisms that are driving disparities are political and economic and not biological. It also means that inequities are produced and do not just happen. So our health equity policy solutions must address access to health care and the factors that shape health in order to have the greatest impact. Next slide, please. It also means that in order to truly address the structural inequities that have produced and exacerbated the disparities that we're witnessing in our country, we would have to do what Dr. King referred to as a radical revolution of values, which will call us to question the fairness and justice of many of our past and present policies. So there's still much more work to do beyond the recommendations included in our report. Next slide, please. The second section of our report includes an action guide, or can be seen as an action guide for health equity advocates, identifying short-term policy options that respond to the current pandemic and longer-term policy recommendations that federal and state policymakers should adopt once the national emergency declaration has been lifted. So in my last 5 minutes, I will provide a brief overview and pull out some of our specific recommendations across these 5 priorities. And they're organized broadly in order from upstream social determinants of health to downstream equity and access to COVID-19 treatment. And some of our recommendations were included in the HEROES Act passed by the House. So to start, since health inequity arises from social, economic, and environmental and structural disparities, or in other words, the conditions in which people live, learn, grow, work, and play, our first set of recommendations center around the social determinants of health. A few of our recommendations under this priority, which are short-term recommendations for Congress, are to improve paid sick leave, including hazard pay for lower wage workers, increasing the maximum SNAP benefit, and preventing and responding to child abuse and neglect, which we have seen an uptick during the pandemic, which is a strong determinant for child health outcomes. One of our longer recommendations for Congress and the administration under our first priority is to pass legislation that targets the reduction of health disparities by addressing the social determinants of health. And our report provides a few examples of bills that have currently introduced that do just that. Our second priority center on how healthcare payment reform is a powerful tool and lever to advance equity in healthcare delivery. That requires improved data collection. So we recommend that states and the federal government should require and incentivize the collection of patient and social behavioral risk data, and that data must be collected on race, ethnicity, primary language, geographic location, socioeconomic status, gender identity, sexual orientation, age, and disability status. We also recommend that states incentivize Medicaid managed care to close disparity gaps, including setting metrics and benchmarks by race and ethnicity, and including required metrics in Medicaid managed care contracts that explicitly measure equity. Our third priority is around organizing and building a robust health infrastructure that will reduce the burden of chronic illness in marginalized communities. We're already seeing now how the effectiveness of our public health strategies and responses in various states are causing a resurgence in COVID-19 cases. One of our primary recommendations under Priority 3 centers around testing and contact tracing, and for lawmakers to use to fund essential efforts with a priority on getting resources to communities at greater risk of COVID-19 outbreaks and those that lack the ability to stand up robust efforts on their own, as well as additional funding to the CDC to expand the contact tracing workforce, including our community-based health workforce, such as community health workers, who are an important bridge between communities and health systems and are trained in culturally and linguistically appropriate care. We also recommend that states submit binding plans to allocate these funds within the state, not only based on disease prevalence, but by prioritizing communities with limited fiscal capacity. Our other long-term recommendations are to fund community health workers sustainably, and I'll refer you to our report for specific recommendations around that. Our last priority is to ensure equitable access to affordable health insurance. We know that we can't fully address this health crisis if we leave large segments of the population entirely out of our insurance-based healthcare financing system, including justice-involved populations, mixed immigration status families, people who were granted DACA, Pacific Islanders who entered the U.S. under the Compact of Free Association, and people with temporary protected status or without residency status. So some of our short-term recommendations for states were for states to implement automatic Medicaid re-enrollment for decarcerated people, as well as to include pre-release coverage for incarcerated individuals or individuals involved in the justice system and COVID-19 Emergency Section 1115 waivers. Our last priority centered around expanding access to COVID-19 treatment for vulnerable populations. We know that access to health care is a critical determinant of health. However, health insurance does not ensure access to timely treatment, linguistically and culturally appropriate care, the ethical allocation of critical care resources, or even that the care that a patient receives is formed by representative clinical trials and a transparent evidence base. And this is even more critical now as we're getting closer to a vaccine. A few of our recommendations for Congress under this category are to provide additional resources to support access to home and community-based services in the workforce that provides them. This is critically important given some of the disparity data that we're seeing coming out of nursing homes, as well as folks who have limited English proficiency. We have a recommendation around providing temporary FMAP for language interpretation services and providing for Medicare reimbursement of interpretation services. In addition to directing the FDA to prioritize racial and ethnic minority populations in clinical trials. And then I'll end with one of our recommendations for states under this Priority 5, is to use new dollars in a potential fourth federal pandemic package to fund local health departments and community organizations to conduct outreach in hard-to-reach communities. We've seen some examples across the country of states and localities doing this. In Chicago, the Chicago Racial Equity Rapid Response Team partnered with 3 community organizations to develop hyper-local strategies to improve COVID-19 health outcomes in the Black community. And including input from community of color is important as we target Medicaid outreach strategies to ensure that the services and messages are targeted and tailored to increase effectiveness. So I leave you with our call to action and refer you to our report for a more comprehensive set of recommendations. So as health equity advocates, we have an opportunity and an obligation to hold federal and state policymakers accountable to communities that have been historically ignored and excluded. We urge you to contact your senators now to advance legislation that prioritizes health equity in the next COVID-19 package. So with that, I am very excited to introduce our speaker for today. But before I do that, I just want to turn it over to Lauren for a quick check to turn to this section of our program.
Great, thanks. Yes, the senator is on, so feel free to go ahead and introduce her.
Great. So I'm delighted to introduce Senator Catherine Cortez Masto of Nevada. to share insights on how we can address the disparities outlined in the report that we just reviewed. Senator Cortez Masto has spent her career fighting for Nevada's working families. She served 2 terms as Attorney General of Nevada. In November 2016, she made history by becoming the first woman from Nevada and the first Latina ever elected to the United States Senate. A consistent champion of health equity in Congress, Senator Cortez Masto has been especially focused on ensuring continued access to mental health services through the pandemic. The senator has also prioritized strengthening the Medicaid program, including signing on as an original co-sponsor to a bill that would create an automatic process to increase a state's Medicaid federal medical assistance percentage, or FMAP, as unemployment levels increase. This would enable states to receive needed aid in a more timely manner and through a streamlined process. As the economy improves, the FMAP bump would subside. Currently, states need to rely on Congress to provide these increases, which often delays their enactment and can force states to make tough financial choices that include cutting jobs and reducing health care coverage. As a member of both the Indian Affairs and Finance Committees, Senator Cortez Masto is exploring ways to leverage safety net programs, including Medicare and Medicaid, to strengthen access to quality health care for Native Americans. The senator is also deeply committed to health care affordability for families. For example, she has introduced legislation to exempt kids' income from counting towards a family's eligibility for health premium tax credits under the Affordable Care Act. She has also joined Senator Sherrod Brown as an original co-sponsor of legislation to address the ACA's family glitch, which bases eligibility for families' premium subsidies on whether available employer-sponsored insurance is affordable for the employee only, even if it's not actually affordable for the whole family. Senator, on behalf of Families USA, thank you for your continued efforts to improve health care access and equity in our communities, and for taking the time to share your thoughts with us today. So with that, I turn it over to Senator Catherine Cortez Masto.
Oh, Amber, thank you so much, and thank you for that presentation. I'm so excited to be with you today to talk about the importance of how we continue to work together to improve our health incomes. And let me just say thank you to Families USA. This new report makes it clear, and I know this from my conversations in Nevada, that the coronavirus pandemic is shining a bright light on the health disparities among our communities of color. I see it in Nevada. We see it in the data across the country. And now it really is an opportunity for all of us to work together to really address how we shake loose those systemic problems in health disparity that we have in our country. And and you touched on a little in your report, Amber, it really means addressing the fundamentals where we see it in housing, right, in job creation and economic mobility, in food security. We're talking about healthcare, but childcare. I mean, there's so many areas where we really need to focus and work together. And that requires Congress working with our advocates, our private sector, and our local and state governments really to improve the opportunities and access for our communities across this country. I know in Nevada, my state is beautifully diverse communities of color, and the goal there, and I still see it with COVID-19, our Latino population is the number one that's hit, but we are still seeing impacts in our Black communities as well in the state of Nevada. So something is going on that we have to address, and now what better time to really focus on how we make long-term structural changes to the benefit of everyone right now. So Congress has been attempting to address this COVID-19 crisis, which is creating our economic crisis, by passing various pieces of legislation. Everybody knows the CARES Act. And it was important for us to get money into, as part of that act, into our state and local governments for the very reasons, Amber, that you just talked about, because they are on the front lines and they can create programs that are essential to addressing the disparities we are talking about today within our communities. We also have to make sure that our funds go towards those safety net hospitals and community health centers that are serving millions of our low-income families across the country. And one of my top issues, and I will continue to address this and talk about it, is how we secure mental health resources for our families to get them back on their feet. It now more than ever, there is a need, and we see it. So let me say a couple of things that Congress can do right now. The House has passed the HEROES Act. The Senate should be taking that HEROES Act and putting it on the floor or through committees and either vote it up or down, or start negotiating in a bipartisan way to get additional relief to our communities. That's not happening, unfortunately. There are many of us in the Senate that want to move forward in a bipartisan way. We know, we literally are hearing it within our states. We just received letters from a coalition of our governors, our mayors, our legislatures, and so many others in a bipartisan way, asking us to start negotiating and helping with the relief, because this pandemic, we're seeing a spike in the numbers. It is not going away anytime soon. We don't have a vaccine around the corner right now. So we have to ramp up the testing. We have to have a national strategy. And we have to continue to support our communities and state and local governments in addressing this health pandemic. But we also have to make sure that the data we are capturing is telling us where those hotspots are and where we have to focus on our communities. And that's why this report is key. I think there's some great ideas that Amber and the Families USA report highlights that we in Congress, I know in the Senate, we are already looking at these areas of focus. We've already passed legislation in support of some of it, and there's other areas that we need to address as well. So I am just thankful for this continued conversation. We cannot let this go. We have to continue to highlight the long-term changes that we need to make to address what we see right now as this health inequities in our communities. Listen, it didn't just occur because of COVID-19. We've had these inequities prior to this pandemic hitting us. This just brings it home to us how severe it is in our communities. So I'm going to continue to work with my colleagues to make sure we're doing everything we can in our communities to incorporate the great recommendations that are in this report, if they haven't been incorporated, and continue to work together to address our healthcare inequities that we see in this country. So thank you for letting me participate today with you, Amber, and I look forward to working with you as well.
Great. Thank you so much, Senator. We really appreciate you joining us today and sharing your insights. So we will now open it up for a brief Q&A while we have you on the line. We'll start just by checking in with the operator, Paula. Do we have any questions from folks dialed in by phone?
If you would like to ask a question, please signal by pressing *1 on your telephone keypad. Also, if you are using a speakerphone, please make sure that your mute button is turned off to allow your signal to reach our equipment. A voice prompt on your phone line will indicate when your line is open. Please state your name and organization prior to posing your question. Again, please press *1 to ask a question on the phone lines.
Great, thanks. And while we're waiting on the phone, we can maybe get started with some of the questions from the chat. So, Senator, we understand that you're working to introduce a bill that's focused on strengthening the Medicaid program. Could you speak a little bit more to the impact that this bill would have for communities of color specifically?
Absolutely. So Senator Casey and I are getting ready to introduce a bill, and what it does, it ties Medicaid funding to the state's economic indicators so that that federal support in Medicaid dollars rises and falls according to a state's needs. So for instance, if you're a state, you have a high unemployment rate. That's a key indicator, tells us that something's going on, and individuals who are unemployed don't have access to health care or can afford health care. So maybe we should be looking at how we support and supplement Medicaid and increase the Medicaid funding for our states around that space. So I think that's, to me, as we start looking at how we tie these federal dollars to true valid data that is out there that tells us where the need is, we are going to do a better job of addressing the inequities And so that's something that we are looking at right now, and hopefully we'll be introducing soon.
Great, thank you. I'll give it a quick check with Paula if we have any questions on the phone.
We do, and we'll go to our first question.
Hi, thank you so much. My name is Leontine Wallace, and I own a Mother Strong maternal infant health program here in Michigan. I do have a couple upcoming meetings with senators regarding health disparities for Black women in our communities, with what they faced with COVID and also just maternal disparities of health. I'm wondering, because as a new advocate, I'm wondering if I should be asking for certain policies or if I should just bring their attention to the issues with the evidence from the report. As this is my first time, I'd love any information that you have. Thank you so much.
Thank you. Actually, both. So you've got great data in this report, and good legislation always starts with data. To me, that's the most important thing, the truth, the data, the verified data that shows that something's going on. So I would bring that in when you start talking to members here in Congress, if that's where you're coming. And then if you have ideas based on your experiences that you're hearing from others within your community, or ideas about how we address it, I think all congressional members, senators are open to those ideas. That's why we have those meetings. We're interested in hearing not only what's happening in our communities, but what we can do to work together to address and find solutions in a bipartisan way. So I think both. And don't, the other thing I would say is, don't limit your conversations just to your congressional leaders in your state. Obviously, here in the Senate to pass legislation, it takes 60 votes. So the more that you can get around and talk to folks about this report and what you want to do, the better it will be to get them already understanding the needs and how we have to make change and work together for a good legislative solution.
Thank you so much. I do want to be respectful of your time, Senator. I know that you had to hop off. So we will have Casey Badmington from Senator Cortez Masto's office on the line also at the end of the webinar to take any further questions for her. I just wanted to thank you again, Senator, for joining us today and for your ongoing work to improve healthcare access and equity in our communities. So thank you again. And now we will turn it over to Clint Odom, SVP for Policy and Advocacy and Executive Director of the Washington Bureau at the National Urban League, to discuss COVID-19 health disparities through a civil rights lens.
Well, thank you very much for that kind introduction. And I want to thank Families USA for their incredible report. We're policy junkies at the Urban League, and this is just policy gold. I want to thank you for allowing us to participate in this important webinar. I also want to thank Senator Cortez Masto for her advocacy in the Congress on behalf of people of color and LGBTQ communities. I will talk a little bit about that later, but the Senator was much too modest about the role that she plays in the Senate on making sure that communities of color are not forgotten in this crisis, which is both one of health and economic catastrophe. My name is Clint Odom, and I serve as the Senior Vice President for Policy and Advocacy at the National Urban League. I also serve as the head of our Washington office. I'd like to say that in the Urban League, we've been working on systemic racism since before the phrase was even coined in the 1960s. Please advance to the next slide. We were founded in 1910 and are coming up on our 110th anniversary. We provide, not only are we civil rights advocacy organization, but we actually provide direct services to about 1.5 million people throughout our 90 affiliate, 300 community, 36 state footprint. As you can see, our mission is for social parity, economic self-reliance, civil rights for African American and other underserved communities. We are focused like a laser on all of the lingering legacies of systemic racism, that is in education and job training, housing, community development, workforce, entrepreneurship, which is something which is often overlooked in these health discussions, and I'll talk a little bit more about that later in the presentation. Please advance to the next slide. One of the things that is unique about being a direct services organization and not just a policy or advocacy type organization is we get to see things on the ground that make all of this research much less of an abstraction, and it shows where the real crises are in the country. These statistics are well known to you, and I will not belabor the point, except to say Black infection rates are higher than our percentage of the population in just about every state in the United States. Los Angeles County may be the conspicuous exception to that rule. It is also the case with the Latinx community, and there are lots of reasons for this. You know, it was said earlier, I think the senator made the point, and so did Dr. Hewitt, that data are the basis of good policy making. And in this space, we rely on a lot of private data. The government data is severely lacking in some places, and we can talk a little bit about where those holes are and how to address them. Please advance to the next slide. So it's important to understand not just that there are disparities, but why they exist. And I think it's a similar explanation in the case of communities of color, as well as, well, certainly communities of color, African Americans, and Latinx people in particular. We are less likely to be in jobs that allow us to telework. My staff and I have been teleworking since March. The only way that we have the luxury of doing that is because there are people, overwhelmingly people of color and women of color in particular, who are working in essential jobs that allow us to do this work. They are working in hospitals and in senior care facilities and in grocery stores and in restaurants. They're doing the essential work that they cannot do remotely so that we can all work remotely and keep this economy having some semblance of moving forward. So it is similarly the case that 1 in 5 Black people, only 1 in 5 Black people can work from home. Only 1 in 6 Latinx people can work from home. And we are across just about every health and education and income measure disproportionately suffering as a result of this crisis. Please advance to the next slide. So how does this play out on the local level in the 300 or so communities that we serve? If you take a look at the map on the first slide, you will see we are almost a perfect overlay for where you find communities of color. About 75% of the clients we serve are African American, about 25% are Latinx. We're seeing things on the ground, and I want to give a little bit of that perspective to you. The Fierce Urgency of Now report has highlighted much of what we see on the ground and really underscores the importance of the work that we're doing, the National Urban League and our affiliates. If you look at the most impacted counties that Dr. Hewitt highlighted in her excellent report, they are places where we have affiliates. Orleans Parish, which is the parish of my birth, as well as our CEO, Mark Morales, Wayne County, Detroit, and Milwaukee. These areas are suffering profoundly from a health crisis as well as an economic crisis. And these two fields are inextricably tied, and it's that relationship that undergirds our approach to how we serve communities. So you will see we borrow very heavily in our advocacy efforts from what we're learning on the ground. We know that that testing is one of the most important steps in getting this virus to heal. So we have advocated for universal testing and treatment, but more important, prioritized testing. So we know where the virus is, we know it anecdotally, and we know it by reference to the testing data. So we need Congress to not just pay for more testing so that anyone who wants a test can have a test. Rather, we need that testing embedded in the communities where we know the virus exists at high levels. We also have advocated for the collection of racial data in connection with who is being tested, who is infected, who recovers, and who does not as a result of this infection. Again, in order to bring this virus to heal, we have to know this information, and being willfully blind to it is not helpful at all. Senator Cortez Masto and her colleagues in the Senate, as a result of their early advocacy on this issue, have convinced and the Centers for Disease Control, effective August 1st, to start recording the data and the gender and other demographic information of the people who are being tested so that we know there's equity in the testing. There are only 3 states currently that are collecting racial data about testing, and effective August 31st, we will have that information for the country. We've pushed for culturally competent contact tracing, which is an element of the HEROES Act. As you can imagine, once you identify who has the virus, that information does you little good if you cannot then go back and contact every person who has come into contact with the infected person. So contact tracing as a human issue is far more effective than any kind of technological fix that we can do here in the short term. We've heard about using smartphones as a way of doing contact tracing. We're not there yet. So human contact tracers are still going to be the most important means of identifying who has been in touch with infected people. We've talked, and I will not belabor the point about investment in access to food and health benefits. Again, the series of bills that we've seen in the Congress on COVID have tried to get increasingly better on this issue, from free testing, free treatment for in-service or in-network healthcare, and even now, I testified just a few weeks ago before the House Oversight Committee on the need to perhaps create a special fund like a 9/11 fund for any workers who die in the line of duty to make sure that their families receive a death benefit so that we do not leave these folks just stranded and with a hearty handshake for being an essential worker. And of course, increased expansion of Medicare and Medicaid. This is something that predated, this was a need that predated COVID and is only more needed in the wake of this pandemic. Advance, please, to the next slide. So how can we take action? And again, so much has been said. I commend you to Dr. Hewitt's recommendations and to the urgency that Senator Cortez Masto expressed in her remarks. I am a former Senate staffer, and in fact, when Kamala Harris and Senator Cortez Masto began their careers in the Senate on the same day, we were tucked away in a windowless basement in the Hart Senate office building for a few weeks. It was an ignominious start to a Senate career, but it was one that allowed me to see her work up close and personal, and the friendship between Senator Harris and Senator Cortez Masto developed in those dimly lit basement hours where we were just trying to figure out where the bathrooms were in the building. But less than 24 hours ago, she went to the floor of the Senate to urge her colleagues to pass the HEROES Act. I only know this because I'm one of these weird people who likes to watch the debates that take place on the floor of the Senate. I don't advise that anybody else do it, but it's an old habit I got into, and I continue to do it. And I'll repeat something that she said. She said, on May 26, Majority Leader McConnell told reporters that the Senate would probably pass more legislation. And now it's the end of June, and we have no legislation from the Senate on the greatest crisis facing this nation since World War II, even though we're hearing constantly from our constituents from our states. And meanwhile, I can tell you Nevadans are suffering. Like almost every state in the country, Nevada has to balance its budget on July 1st, just a few days from now. 46 states have similar budgets they have to balance. The reason I am citing this particular line to you is because inside the HEROES Act is about $1 trillion worth of funding that is desperately needed by the states and the localities to keep operating budgets afloat. For all the talk about defunding the police that has captured so much attention in the country, very few have given any consideration to the fact that we may be defunding our police, our garbage pickup, our teachers, our first responders, because city budgets are busted as a result of the loss in revenue caused by the coronavirus pandemic. So I cannot more vociferously urge to anyone listening, the most important thing we can do is ask and demand that our senators take up and pass this legislation. We need a national collection and reporting of racial disparities data. That looks like it may be coming, but I'd like to see what actually happens effective August 1st. We need universal and prioritized testing in communities of color to make sure that our frontline workers and our caregivers for children and seniors and anyone else, that people are safe. And if they're not safe, we can put them into quarantine and allow them to get treatment and to survive this crisis. We need culturally competent contact tracers who are from the communities, who look like and speak like the people they're interacting with. And we need to make sure, especially for women of color who are disproportionately represented in the ranks of essential workers, that we have the ability to get paid time off, to get treated, and to prevent the spread. Women are asked in many ways to bear the brunt of this unemployment, to be on the front simultaneously, to be on the front lines of this crisis, and to be a primary caregiver and head of household for our communities. And if we can't do this for them, we are betraying the highest values of our country, and we will never get back on our feet unless we take care of this leave situation. So on that note, I will advance to the last slide and show you the picture of our team here in the Washington Bureau. We are at your disposal for research issues and advocacy issues. This is one of the brightest teams that I'm so proud and honored to lead in all of the Washington advocacy circles. So with that, I will stop and entertain any questions. And again, thank you to Families USA for the kind invitation.
Thank you so much, Clint, and thank you to the National Urban League for their partnership in this webinar. We really appreciate your insights. So with that, we will move to the Q&A portion. And just as a reminder for folks, we do have Casey Badmington on the line to field questions on behalf of the Senator Cortez Masto's office. So if you're signed into the web platform, you're welcome to continue posing your questions through the chat box. I'll also turn it over to Paula to quickly share again how to ask your questions if you're dialed in over the phone.
Thank you. Once again, it is *1 on your telephone keypad. As a quick reminder, please make sure your mute button is turned off to allow your signal to reach our equipment. And please state your name and organization prior to posing your question.
Great, thank you, Paula. So we can go to one of the great questions from the chat, and I think that we can maybe start with Amber on this, but I imagine that all three of our speakers can have some insights on this question. So this question is from Janice Phillips, and Janice asks, how can we best work with our local legislators to implement these recommendations? Is there any evaluation tool or report card that we could refer to on how our localities are doing, and how can we best mobilize communities to around this report and the recommendations shared today?
Sure, Lauren, I can get us started, but definitely open it up to Clint and our other speakers. One, I think, Janice, you posed a really great idea, and you posed a lot of great questions. The part about the evaluative tool and a health equity report card, that's something we've been talking about here at Families USA. And if there's others on the line that are aware of health equity report cards, I definitely would welcome that information. In my research, I have not seen a very comprehensive health equity report card. Obviously, there are lots of rankings that look at some of the social determinants of health, such as housing, transportation, access to food, similar to the Robert Wood Johnson County health rankings that we use in our report. So I think state report cards are a very powerful tool, and one that we can leverage more, and one that we're thinking a lot about here at Families USA. I also want to flag that in the report, and it probably didn't come off in my presentation because I was trying to give a high-level overview of our short-term and long-term recommendations at various levels of government. But I do want to flag that in the report, the state-level recommendations are labeled for easy identification, so you should be able to pull out pretty easily those recommendations. But I'm really excited about your question about mobilizing communities around the report. So I welcome you to contact me directly to further brainstorm ideas. And part of advocacy is education. So I think in mobilizing communities, it is they are really the experts. Folks in the communities are really the experts of the lived experiences about what we are talking about. I know there's a lot of energy and activism in communities right now that can be leveraged. So I welcome a further conversation about that, and I know probably Clint could speak to the state affiliates of the National Urban League and the great work that they're doing there as a way for communities to mobilize the recommendations in the report, and also the specific recommendations that Clint outlined from the National Urban League.
Excellent. And thank you for the question. One of the tools that we use in the Urban League is the Kaiser Family Foundation. They do very good work on capturing several health measures and indexing them relative to other states, rates of insurance, Medicare participation, other metrics that are very important. So if you've not accessed kff.org, I urge you to. I also urge you to talk to your local officials and have them write letters and interact with their congressional delegation. There is a real sense among certain members of Congress that cities don't need any assistance right now. Our states don't need any assistance because their cities are poorly run, and therefore they shouldn't get any support. We are about to enter into a dystopian post-apocalyptic world if that money does not get into the hands of states and locals. You heard the words of Senator Cortez Masto about 46 states having to present budgets on July 1st, tomorrow, that will be horrendously out of whack. So we need municipal and state officials talking to their delegations. On the ground, we have had our affiliates write letters to governors, for instance, urging them, if they have not, to take advantage of Medicaid expansion. We have had them write letters to governors asking them to collect racial data at the most granular level possible, such as census tract or something beyond just the state level data. As I said, there are only 3 states who are currently tracking the racial demographics of people who are tested if we don't know who's being tested, we actually have no chance of defeating this virus. That information is late in coming and is absolutely indispensable to getting it. Unlike every other instance when communities of color health is ignored, we generally pay a price in terms of loss of productivity and higher healthcare costs, which is why our spending on a per capita basis is higher than any other countries. But this is one because we're talking about a viral infection. If we don't bring this to heel in low and middle income communities, frontline workers, and communities of color, this disease will reach, no one is exempt. There's no partisan divide on infection. There's no wealth divide. There's only, do we bring this disease to heel or do we let it run wild? And demographic data are key to bringing things under control. I hope that helps.
Great, thank you, Clint. And I think we'll quickly see if there are any questions on the phone line, and then we can go to some of our other chat questions.
And there are no phone questions at this time. As a reminder, *1 for questions on the phone.
Okay, great. So I think we have a couple questions that I think go hand in hand from Ronnie Coleman and Denise Robertson. So I think we can maybe pass this to Casey first and invite others to chime in. But the related questions are, first, how can advocates best reach across the aisle on some of these priorities? And then secondly, where there is a kind of gridlock, what are some of the kind of, I guess, low-hanging fruit that advocates can really push for in the short term?
Yeah.
Please, go ahead.
I was just going to say, I think the data is the best place to start in order to build relationships across the aisle. There's also a ton of information out there on that Families has put together, that a couple of the other sort of bigger number crunching advocacy organizations, Center on Budget, Policy Priorities, Center for American Progress, on the savings that can be delivered to the system when you make some of these upfront investments in sort of, like sound communities. And so I think that's always a place where you can hook Republicans. A dollar now will save some money and investment down the road.
This is Clint. We're in Congress a lot. There are a couple of issues that seem to have some bipartisan traction. Again, although not immediately apparent as a health issue, small business recovery, which is critical to communities of color, is an issue that does get good uptake on both sides of the aisles. The massive unemployment, and we're looking at a national unemployment rate of about 20%. African American unemployment is already there. I guess we'll get jobs numbers from the Labor Department for June, and I think I hate that this prediction will come to pass, but it probably will. So making sure that we're dealing with not just the health consequences here, but the economic consequences, and trying to salvage some remnants of the 440,000 Black small businesses that have been lost or at risk of being lost in this pandemic is an issue that gets really good uptake. Data, couldn't agree more. And maybe even in some of these states that are looking to distance themselves from a largely laissez-faire federal approach to the crisis, Medicaid expansion. I think we may be looking at states that have shunned it in the past who might be open to it now, especially, depending on the outcome of elections in November. We're a 501c3 organization, so we don't play in this space. I'm not advocating anything partisan, but I'm saying Medicaid expansion could get traction among America's governors and lawmakers in Congress.
And this is Amber. I just thank you for that feedback. I have two quick things because I saw something in the chat box about CHIP. And I do want to highlight that we do have several recommendations around the Children's Health Insurance Program. And I do want to highlight the pandemic's impact on children, particularly kids of color. So I don't want to be remiss in that. So I will refer you to the report for more information on that. So thank you for bringing that up in the chat box. And then just double down on one thing that Clint said and the Senator said around the importance of state fiscal relief, which is one of our key priorities, and how that will greatly impact some of the cuts that may be made to programs that are directly tied to equitable health outcomes.
Great, thank you, Amber. So with that, we're getting close to the hour, so I'm going to go ahead and thank our speakers for sharing their expertise today. We really hope that the tools and information that we discussed today will help all of those on the line to take action at the state and federal level. We've included some resources to support your advocacy on this slide, and we will be sharing the deck along with the recording to those who registered for the webinar. So those resources include the full report from Amber's presentation, as well as a fact sheet and an infographic focused on what Congress can do right now to center health equity in their response to the COVID-19 crisis. We also continue to update our COVID-19 response toolkit with timely resources and analyses to support your work. If you aren't already on our email list, you can sign up at familiesusa.org/sign-up to get updates on new resources and upcoming webinars. And we also invite you to share your feedback on this webinar and on other ways that we can support you in the post-webinar survey. So thank you again for joining us. We hope you have a wonderful rest of your day and stay well.